Hello, this is Wendy Ayers. This is for SEPS 750, Dr. Watson, and this is the interview portion of my simulation. I have my patient here today who is Miss Ponton or Cindel Ponton, and she is here. I have an order today to do some breathing test on you because the physician was concerned about your shortness of breath and your lack of feeling like you could take a deep breath. So potentially he's thinking that for some reason or other you may have some type of a restrictive process. So I'm just going to go through the interview process and ask you a few questions. So just answer them to the best of your ability. So how old are you, Cindel?
22.
Great. So have you been having trouble breathing, especially in the last 4 weeks? How often have you been short of breath?
Usually I'm short of breath at least every day. Sometimes it'll be more than once a day.
Okay. How about your cough? Do you ever cough up any mucus or phlegm?
Especially in the morning I do.
Okay. And how much and what color is it?
I wouldn't say it's a whole lot, but it's pretty thick and it's usually clear.
Okay. All right. And your shortness of breath, when you're short of breath, how do you get your breath back? What are you doing to catch your breath, so to speak?
Usually I just take a break and sit down and just don't do anything for a couple minutes and then it'll come back.
Okay. Do you use any particular breathing techniques that help, or
I just take a break.
just take a break? Okay. All right. So have you found that in the last 12 months that you are doing less activity?
Yes, I do a lot less now than I used to.
And is that because it's really hard for you to do it because of the shortness of breath? Or?
Yeah, when I do things I get really short of breath.
Okay, so that's limited what you've been doing. Um, what kind of activities are you having shortness of breath with?
If I go to the store, by the time I get there and I walk around the store and buy my groceries, I'm tired and I'm short of breath by then. If I do anything where I have to do physical activity, I get really tired and short of breath.
So you have to stop and take a break when you're doing things?
Yeah.
Okay. What about at nighttime? Are you having problems breathing at nighttime?
Sometimes, every once in a while, I'll wake up and I'm really short of breath.
Is that mainly when you're laying flat, or do you need to set yourself up a little bit to breathe, or?
It's when I lay flat.
So do you sleep on pillows
Usually.
to prop yourself up some?
Yeah.
Okay. What about allergies? Do you have any allergies?
Not that I know of.
Okay. What about smoking? Have you ever smoked?
I've never smoked.
Okay. And so what kind of work do you do?
I'm a cashier at Food Line.
Cashier at Food Line. And so you're not exposed to any kind of chemicals or anything. What about family history? Do you have a family history of any type of lung diseases?
Not that I know of.
Okay. All right. Well, this is pretty much everything that I needed to know for your history, and we're going to do a physical exam, and then we will start with your spirometry testing. Okay?